Hello, Don here. Welcome to Podiatry Practice Mastery, where we're helping you get your practice to the $2 million mark and beyond. So I have a question here. So people tend to send me questions, and I sometimes think it's easy for me to email them, but I think if one person has a question, a lot of other people probably have questions. So I'm going to share it here. So I guess the first question this doctor was having, we're talking about nail fungus. Now, nail fungus isn't the greatest thing to talk about, because some of us don't like doing it, but really, I remember one time I heard a doctor said there's gold in those toenails, and there certainly can be. And he was asking kind of what my current protocol is, and he was kind of sharing his current protocol. And he was telling me about a new website, which I'm not familiar with, so I haven't vetted this website, but he was talking about clearnail.com, and it looks kind of promising. But what his current protocol is he really just goes over the top 3 treatment options, and he goes over the pros and cons. So he says, okay, you have topical, you have oral, and you have laser. So topical, the pro, it's easy to put on daily. The cons, it takes forever to work because of nail penetration. I would add to that, I don't think it works all that well. I guess he says forever, but I would just say it doesn't work. I don't do much topical. Oral, pros, it works great, and temporary medication. The cons, no alcohol, speeds up the liver, and blood tests every 45 days. Now, maybe this is just the way that I do it. I don't tend to keep people from alcohol, and I do say it makes the liver, I like the wording of speeding up the liver, but it makes it work a little bit more. And I don't even repeat liver function tests every 45 days. I do it in the beginning, and that's about it. Maybe it's just because I've done it so long and I've never had any adverse effects. But that's just kind of the way I do it. And so maybe the way I'm explaining, I'm just thinking out loud here, if I explained it with more danger, like we have to repeat the blood test, or we have to, you can't drink any alcohol, I think that would probably push a lot of my patients over to the laser option. Then his laser option, he has a class 4 laser, which I think many of us have class 4 lasers. And he says it works great, no medication needed, FDA cleared. Standard of care is 3 treatment sessions. The cons is it's not covered by insurance, and he charges $500 per session, so $1,500. And then he's asking, with the above script, the patients typically always do laser, and I always recommended combining it with Tosalin and the laser. So the topical is like $90, and the laser is $1,500. So he's going to be switching it for this clear nail, and or he's considering switching it for clear nail. So I've tried a number of things. Currently what I'm doing, and I keep changing this because I own for names, if you want to know, I own a Genesis Plus Cutera laser. I own a Remy laser, and I own a Lunula laser. Now I wish the lasers worked as well as things are promised. And I've said this over and over again. I have a hard time doing things and then not having it work consistently. It just I lose a lot of sleep. It doesn't really work well. I just don't like that. I don't like saying sorry, you just blew $2,000 with me and it didn't work. That's the first thing. The second thing is I find a lot of these laser sessions, if they're unmanned, they just occupy the office a lot, meaning I don't have enough rooms in my office. Like we have 6 treatment rooms. We usually have 2 doctors going, and so to have that one room occupied with that laser going doesn't really work well. So what am I currently doing, and what would I kind of recommend? So currently what I'm doing, I have a thermal and non-thermal laser. So I would say thermal would be the hot one, and I'm doing so I'm nail sample, follow-up visit, going over the nail sample. If they want the laser, I'm doing a thermal treatment. So before I debride down the nail, I'm doing the thermal one because it makes it a little bit easier because you can heat it up more. Then I'm debriding down the nail, maybe even grinding down the nail. Then I have them do 4 sessions of the non-thermal, which would be the Lunula. And then I see them in 3 months, and I do 1 more thermal. So I'm doing thermal, and for me it's $150 per foot, so it'd be $300 per session. So it ends up 6 sessions total, about $1,800. And then they do my preventative kit, which you may have heard about, but I'll explain it again. It's about $200. It's the UV light, the shoe spray, and then the biotin that they're doing. That's kind of helps the nails grow and helps to prevent the recurrence. And then I do recommend, I have a topical in the office. I'm not super hyped on it, but I do recommend the topical at the same time. And so if he's going to integrate, this doctor's going to integrate this clear nail, it really just depends on how many sessions it is. And I would keep it at the same price. So if they're willing to pay laser, that's fine. I want to give an example. I was at a recent webinar, and I heard one of my colleagues say what they do. So clear laser, clear nail might be similar to like ToeFX. I know a lot of people are doing ToeFX now, and so she's combining laser with ToeFX, and maybe you can combine clear nail with your laser. That would be one option. And so you could kind of do them both together, and then you would kind of figure out a package of what would be worth it. I think around the $2,000 mark is good. And then I always think about, well, what's the plan B? Like if things don't work and if it's not clearing up, then you would say, well, for at no cost, we'll transition you to the oral because we've tried everything else we can that is non-medication. And I think some patients appreciate that if you're going to do it that way. So this would be my recommendation with this clear nail. It really depends how many treatments it is, but I would keep it around the same amount. And he was mentioning that patients like to pay as they go. I have, for laser, I have some that pay as they go. I don't do a ton of laser, but for Shockwave as an example, most prepay. And then I would just give them a 10% off because we can schedule everything out. And so you could kind of similarly do this for them if they're scheduling things out. You could just say, hey, the whole package is like $2,000. If you prepay, you get $200 off of all that on the first visit. Otherwise, or you can, if you want a discount, otherwise you can just pay as you go. So this would be my recommendation for when we're doing something else in the office. And that's kind of what's working for me at this time. Okay. Once again, if you guys find this beneficial, share this with some other people, other podiatrists. I know there's many that don't know about this podcast. Put a lot of work and love into it, and hoping you get your practice to the $2 million mark. Okay, thanks.